go to next speaker, Dr. Rajwinder Kaur Bhattal. We have many professors here.
Okay.
I can see. So she will also speaking my experience with 2 mm data Sahu incision.
Very good morning, everyone. And it's a beautiful morning here on the last day. I want to thank All India Ophthalmological Society and Manual Small Incision Cataract Surgery Society, Dr. Boramani sir, Dr. Sahu sir for giving me this opportunity. And my topic is Dr. Sahu's 2 mm small incision cataract surgery, my experience. No financial disclosures. I love inspiring people, and if I can make difference in one person's life, then that's success for me. So when we learn the technique and passing to the future generation is very important, how we can pass to the future. So education isn't something you can finish. So still we are learning the newer techniques in our field. So change, but start slowly because direction is more important than speed. So when you should think of doing 2 mm SICS. First of all, you should be confident with the normal manual small incision cataract surgery, 7 mm, that is when it is a hard nucleus, 7.5 mm. Then try shift slowly. First, change to 6 mm incision, and then also document the findings, that how your astigmatism is changing with the change of the size of the incision. Then, when you are confident with that, then change to 4 mm incision. So, I don't tell everyone to directly jump to the 2 mm SICS. So, transition is important. So, change to 4 mm first. Then, when you are comfortable with 30 to 40 cases, then shift to 3 mm incision, and finally to the 2 mm incision. So, that is 20th May last year. It was when manual small incision cataract surgery, it was introduced to us, Dr. Karamjit sir and me, by Dr. Sahu sir at Amritsar. So we feel privileged to be introduced to this technique. So Dr. Sahu sir performed, we did I think on that day around 8 cases and 6 cases by sir, that is 8 to 10 cases, 2 by Dr. Karamjit sir and 2 by me in front of Dr. Sahu sir, and it was live as the residents were also having a feel of it, and they were seeing it, witnessing it. So the special instruments introduced by sir to manipulate the nucleus delivery, so as to minimize the complications related to the smaller incisions, which we think that they can occur. So this is the video of my first attempt on 2 mm in front of Sahu sir. So incision in making and the nucleus delivery. So we can hear in this technique, there are 2 main things, the incision. The previous speaker, that is on the physics of the incision, has been beautifully covered by Dr. Nilupratna. That is how it is to be made. That is 1.5 mm from the limbus, and the back cuts, they are very important because they close the incision as a purse string incision, so the minimizing the astigmatism. So all the other steps, like the rexes, we all are confident in that, and making the tunnel and the delivery of the nucleus is important. So the delivery of the nucleus, how is to be done through the 2 mm incision. So the nucleus can be bisected or trisected with the various techniques. Here I am using that is bent visco cannula. You can bend with the needle holder. So no other instrument is to be bought. You can bend the that is the front of the needle of the visco cannula with the needle holder, and just you can bisect the nucleus into and other tricep. And then the delivery is, I still use, that is the superior rectus forceps, but with the experience, I think I will be able to use the minimal manipulative techniques, but I'm still exploring myself. So we can see the nucleus is bisected, and it is brought through the 2 mm incision. So this was my first case. The 2 cases went well. And here I want, the case which I did independently after learning this technique. So that is the mature senile cataract. So I just forward it, like making the incision. So when you are beginner, you can have a bisect in the incision on the periphery. So it is beautifully covered that how to minimize it. Your crescent can cut so you have to go around the globe, like the globe. Like in manual small incision we always tell. So the nucleus is brought into the interior chamber. This wire vectis should be you have to decide it, that the bigger one you have to avoid it. It is a straight with the serrations over it. So when you fix it with the that is bent visco cannula, the nucleus doesn't move. So you have to just bring on the wire vectis, you have to bring the nucleus over the that is the wire vectis, serrated wire vectis. So you can see the serrations on the wire vectis. So it is to be used. And you can bisect, and the epinucleus comes like very easily. And you can put the foldable or the non-foldable intraocular lens through this. And all the steps are steps are similar.
Rajwinder, please conclude.
Yes, sir. Just I am concluding. So this is the immediate post-op picture. You can have corneal edema, but it just settles within a week with the good incision. Thank you so much, sir.
Thank you, Rajwinder. So
These are the few post-operative pictures. Thank you so much.